Vitality Specific Chiropractic in the Ballard area of Seattle, Washington, and today I want to talk a bit about statistics involved in motor vehicle accidents and kind of more also what to do if in the unfortunate event that you're in one. So studies show that 93% of all collisions or rear impact collisions are due to the striking driver's inattention, meaning that you might be driving safely yourself, but not everyone else around you is. Because that doesn't mean that we don't want to continue to drive safely, but aware that these things happen a lot of times when we're doing things right. Of that, roughly there's about 12 million car accidents in the United States every year, and of those 25% are rear impact collisions, and 3 million of those people involved in them are diagnosed with what's called whiplash injuries. So whiplash is just a term that's used to describe the violent manner in which your head will be actually pushed violently backwards and forwards in a quick manner, and it's really the acceleration that's the important part of that, damaging soft tissues and creating misalignments within the neck and back. Rear impact collisions with a less than 5 mile an hour closing velocity are called LORSIC, or low speed rear impact collisions. And this is the majority of collisions, and a lot of insurance companies will say that there's not injury that can be related to these because lack of damage. Now, to give you an example of what goes on within your neck with that, roughly in 5 miles per hour, can create about a 6 to 12 G force to your head and neck. That's a lot. So an example, like a fighter pilot, a jet pilot, in a vertical pull can experience up to 9 Gs. Another example would be if you caught a 10-pound sandbank from 2 stories up in your arms, that's similar to the kind of force that you're getting in your head and neck. So it doesn't seem like that's possible, but it really is. And a lot of reasons why these insurance companies are saying that there's no damage is because the car makers have designed bumpers to withstand 5 to 8 mile an hour impact collisions, meaning that the bumpers don't get damaged or they don't collapse. So you get more of an elastic collision at low speed. So rather than the car taking the energy from the hit, it's actually you inside your own car, and mainly your head and neck, that's taking that force and creates a lot of damage. And you may not have any bruises or cuts or anything from it. So the important part with this then is determining whether or not there's injury. And this can be difficult because sometimes when people are in these accidents, well, many times, there could be weeks or months go by before they might notice any real debilitating or noticeable symptoms. So what's really important if you're in one of these to get examined as quickly as possible. And I'm not saying that you need to go to an ER because you don't have an ER type problem. Really, you need to be in an upper cervical chiropractic clinic to get this determined. In the Vitality Specific offices, we do a real thorough neurological and orthopedic exam to determine disability or problems from these types of injuries. We also do a really extensive imaging for the head and neck. We're now using cone beam CT imaging, which can give you a 3D perspective of your head and neck and give us a real close-up vision of what's occurred to the damage and how to fix it. And so with the work that we do, everything is tailor designed to the individual without cracking, popping, or twisting. And we can restore spinal health with the least amount of adjusting. Studies will show that in the US, there's roughly right now 45 to 50 million Americans suffering from symptoms related to car accidents that were treated improperly. Many of these people have had their symptoms for as much as 15 years or longer. So the quicker that this gets diagnosed and treated, the less chance there is for long-term problems in healing. And when that long-term problem settles in more, there's more soft tissue damage, scar tissue occurring, which can create arthritic changes to the joints, which can lead to a lot of pain and disability problems that could have really been avoided had it been treated properly. So it's important to make sure that you get into a clinic as soon as possible if you're in the Seattle area. We are accepting new patients for car accidents. We do treat a lot of people with that type of injury, and I would consider us to be experts with that. So if you or yourself has been in one of these accidents, be sure to give us a call, or you can go to our website, vitalityspecific.com, and determine which location is best for you. Thanks.